Good afternoon, everyone. Thank you very much for joining us today. My name is Kai-Ying from Pinky. I'm the director of Avenida's Chinese Community Center, also called ACCC. Welcome to this bilingual health webinar, Puzzling Symptoms, Is This Cancer? Thank you for choosing us to spend your next hour to be with us today. We are honored to have this partnership with Stanford Cancer Supportive Care Program. Today, we are honored to have guests from Stanford Health. Please join me and welcome Nurse Coordinator Esther Chen. She speaks Cantonese, Mandarin, and English. Esther will be our guest host today. Next, let's welcome our guest speaker. Dr. Linda Geng is an internal medicine doctor at Stanford, and she leads the Consultative Medicine Clinic, which is a diagnostic second opinion program. She has a passion for improving diagnosis and working with her team to help patients with puzzling conditions. Let's welcome. Thank you, Dr. Geng, to be being here today.
Thank you so much for that introduction, and hello everyone. Good afternoon and happy early holidays. So this is such a wonderful privilege. I'm very excited to be able to speak with you today about this important topic. Puzzling symptoms, is it cancer? And my background is in internal medicine. So I am a generalist, not an oncologist, but I think this is an important area where many patients are sometimes worried about their symptoms and whether or not it could be something like cancer or another concerning finding, or maybe they've Googled something and they're concerned whether it could be something that is leading to a significant pathology. And so I just want to first put this disclaimer out there that this presentation is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always, always consult your own doctor or other healthcare professional about your personal health concerns. I'm hoping to be able to provide you some guidance and education and general information about puzzling symptoms and when you should speak with your doctors. But if you have any concerns, please make sure to go ahead and directly contact your doctors or clinics. In terms of what I'm going to be talking about today, it will be these 6 main topics. First, what are puzzling symptoms? What does that mean? And second, what can make a diagnosis difficult? Third, what are common causes of these symptoms? Fourth, when should you worry about cancer? 5, what should you tell your doctor? And finally, 6, wanted to present some resources that you can refer to and some other tips for engaging with your healthcare professional. So puzzling symptoms, what are they? And what makes symptoms puzzling? Puzzling symptoms are usually symptoms that you experience that are unclear, confusing, or do not have an obvious cause. Usually if you develop, say, a runny nose, a cough, you might know, okay, that's maybe a cold, a viral infection, and it's not too puzzling. You might get the diagnosis and it might self-resolve. Sometimes you have symptoms that could be from a lot of different things, or it's not clear why you started getting that. For example, sometimes feeling tired for no clear reason. You didn't just run a marathon or go hiking, and it's not clear why you're feeling so tired more than usual. Or unexplained pain. You didn't have an injury, you didn't fall, or you didn't, strain this, but it really hurts there and it's not going away. Or unexplained bruising. You're starting to get bruises in places you never got bruises before. Nausea, sweating, weight loss, rashes, tingling, twitching, and some other symptoms. sometimes our bodies can experience some of these symptoms and they're very transient and they might go away, but sometimes they linger, and that might be worth further evaluating. Now, as I mentioned, when you go to the doctor with your symptoms, the general expectation is that a diagnosis will be made, right? You go with a runny nose, cough, and it's probably a cold. But sometimes it's not so simple, and it can be difficult to make the right, accurate diagnosis. What makes something difficult? Well, some of those puzzling symptoms can be. The symptoms can be very non-specific, meaning it can be caused by many different things. For example, fatigue or feeling tired. You could be tired because you didn't get enough sleep. You could be tired because you overexerted yourself. You could be tired because of an illness, or all different kinds of illnesses. And there could be so many different reasons. You could be dehydrated. The list really is long for potential causes of that symptom. And so when you go to the doctor, they'll probably ask you a lot of other questions to determine the underlying reason. And sometimes if you have a lot of symptoms, and there are many symptoms, it can be difficult to make the diagnosis too. In our clinic, for example, we see patients for diagnostic opinion who have sometimes one symptom that's unexplained, or sometimes 10 symptoms that are unexplained. And that can really be a challenge. As you can imagine, putting the pieces of the puzzle together is, it can be very difficult to do, as each of those symptoms may have a lot of possibilities. And then when you add up all those different possibilities, the list is quite long. And then sometimes it's about the timing. When it's a little too early to tell, maybe you started getting tired, but then later you started getting a fever. Well, that points you down another direction. And maybe later on you have a rash. Okay, so there's more data and more information for your doctor to then be able to make a full evaluation and assessment. Sometimes there's no definitive diagnostic test. Now, if you're worried about cancer, usually there is a way for doctors to look for that specific cancer for most cancers. Usually you need the tissue sample of the cancer that you're concerned about. So for example, if there's skin, a mole that you're worried about skin cancer, the doctor will take a sample of that and look at it under the microscope and see if that's the case. There are sometimes symptoms that or conditions where there isn't a clear, definitive final answer kind of testing that can do that can tell you the answer. Many times the doctors will have to listen to your story and put together all the pieces of information to make that conclusion and diagnosis. So if you do have these puzzling symptoms and you're wondering, is it cancer? Before you jump to that kind of worry, because of course, anytime you think about cancer, it causes a lot of worry and it can lead to a lot of anxiety. And so let's think before we jump to cancer, what are some common non-cancer causes of puzzling symptoms we should first also consider? And these are important. And when you talk with your doctor, you should be clear about the medications you're taking. Did you start, stop, or change a medication? Are you on any supplements or herbs that you're taking, especially around the time that your symptoms started? A lot of medications and supplements can have side effects. And especially if you're on multiple, they can interact with each other in unexpected ways and make you feel unwell. And of course, we need to also understand your current medical conditions. If you have other organ or health issues, that might be contributing to why you're feeling so tired. And that's important. Diet and lifestyle changes are also important. If the food that you eat, if you're not getting enough nutrition or calories. That might be why you're losing weight. If your recent lifestyle has really changed in terms of trying to be healthy and exercising more, maybe that's why you have pain now, because you've strained those joints or those muscles. Also, infections, it's important to know if right at the beginning, did you have some kind of cold or flu-like symptoms or rashes or any kind of fever that might have triggered something, and that's important for your doctor to know, even if that infection is now resolved. And also procedure related. Did you, before this, have some kind of surgery or operation? It's important for that doctor also to know that you've experienced new symptoms, and it's important to know and notify that doctor about your new symptoms in case it's related as a complication or unexpected symptom of long-term after that procedure. So these are a list of some things to think about as you're working through your puzzling symptoms. But what about if you've talked these aspects over or thought about them and none of them really apply and you still can't explain your symptoms? There still are other possibilities, and there are many other possibilities. But when, as we in medical field call it, are red flags coming up. Red flags means it's an alert. It means think about something, hold on. Let's make sure that you're having careful evaluation with your doctor when these things come up. And so when should you think about the possibility of cancer? Now, like I said, it's sometimes it causes a lot of anxiety to jump to that conclusion. So before you jump to a conclusion, at least think about having the conversation with your doctor about what else could this be, and should we evaluate for anything like cancer if I encounter this. Well, before we even think about diagnosis of cancer, let's try to think about and understand what exactly is cancer. Because we say that, and it's one diagnosis, but it actually is multiple conditions under the one umbrella of cancer. Cancer is, by definition, your cells of your own body that have started to grow and make copies of itself uncontrollably. But there are many different types of cells and many different types of cancer. And so they can, and I think this is important to understand, you can have cancer of the blood, of the, of your skin, of your organs, and there are many different cell types within that. And depending on the cell type and the location, the symptoms you experience can be quite different. There are many different types, that's important. And some cancers will have very specific symptoms. Like breast cancer, you might have a breast mass, and that's pretty specific in a location and in a tissue type. But some cancers will have no symptoms early on. And unfortunately, that makes it also difficult to diagnose and pick up early. And this is where it's important for cancer screening. And I want to emphasize that it's so important to have regular care with a primary care doctor, because that's who would, be making sure you're getting your health maintenance, who knows you well, and can make sure you're up to date on your cancer screening that's appropriate for your age. And that includes breast cancer, colon cancer screening, some of the most common cancers in the United States. And family history, that's also important. If you do have a strong family history, meaning you have multiple family members, especially first-degree relatives, meaning your siblings or parents or children who have cancer or a certain type of cancer, and you start to have symptoms in that area or that type of organ system, then it really is important to bring it up quickly with your doctor and tell them about your family history. And again, emphasizing the importance of primary care. A lot of it is screening and prevention, but also a lot of it is getting to know you well, and having a doctor who's examined you before, knows you and your life and your habits and your lifestyle and your conditions. So what are some of those red flag symptoms or warning signs where you should really have a good discussion and evaluation by your doctor? These are some lists, but I want to just, again, kind of make you aware that a lot of the symptoms are non-specific, which means that it could be caused by many other different things. But a couple of themes come out, which are, if it's not going away and it's not explained by something else, you should definitely bring this, you should definitely continue to evaluate and think about things. The top one, they're in no particular order, but a couple of the ones at the top are what we call sort of general symptoms, or constitutional is another name. And these could be related to to some forms of cancer. Weight loss, unintentional. That means you didn't mean to lose that weight. You were eating the same as you do, having the same activity as you do, but now you've lost more than 10 pounds over the last half year or less. That you should definitely have a discussion with your doctor. Fatigue, extreme tiredness that doesn't get better with rest, and it's not going away, and you can't explain it otherwise. Fever or night sweats. You can get fever sometimes and even sweat sometimes when you get, say, an infection. And if that goes away, the fever goes away. But if you don't have an infection, you still get fevers or night sweats, and it's persistent or recurrent, you should definitely have that evaluated by a doctor. If you have new lumps or masses anywhere in your body that doesn't make any sense, please have that examined and evaluated as well. Poor appetite, difficulty swallowing, or feeling full very early. So these are gastrointestinal symptoms that can reflect various things that might be going on in your mouth or in your esophagus or your digestive tube down to your stomach. And that's important because if you are experiencing this and you have no other reason to, you should ask your doctor why this might be happening. Changes in bowel habits, and that includes black or red blood in the stools. Now, a lot of times people can have hemorrhoids, and those are swollen blood vessels, veins down in the rectal area, and that can cause some red blood in the stools. So I don't want to be alarming you that all these mean cancer. It's just some things that you need to evaluate with your doctor and say, could this be hemorrhoids, or do we need to look further into things? Constipation or diarrhea that doesn't go away. Sometimes you can have some loose stools. Sometimes you're going to get a little bit constipated, especially with different medications or other diet changes. But if this keeps happening or the stool's quality changes and you haven't done anything differently, please make sure. And changes in your bladder habit. Is it more difficult for you to urinate? Is there blood in your urine? You should definitely bring that up with your doctor as well. And then the other thing too is if you have multiple of these at the same time, that, for example, you have changes in your bowel habit and weight loss and fatigue, that's definitely something you need to have an evaluation for. And other symptoms, a headache that doesn't go away, a cough that doesn't go away. You can see the pattern here, something that doesn't go away, and bruising in excessive or unusual places. What are those? So, it's common, especially as we age, our skin gets more fragile, and it's easy if you bump something, or even if you don't, and if you're on blood thinning medications, it's common to have bruises on your arms, sometimes even your legs, but it's not very common to have bruises on your abdomen or your chest or your back. And if those things start to happen, or you have tons of bruising everywhere and on your face or other places, you should really have that evaluated. And after menopause, you should no longer be having menstrual bleeding. But if you have menstrual bleeding again, that's something that needs to be evaluated too. Unexplained pain that doesn't go away or worsens. This has two key points here. Pain can be from so many different things. But if it's unexplained and it doesn't go away, I think you see the theme here, the pattern, you should definitely get that evaluated. Skin changes. For example, if you have a mole, it's very common for us to have moles, multiple moles, but if they're growing or changing, and especially if you've looked at it and it's continuing to change, please make sure to get that evaluated and looked at. If you have a rash that's getting worse or spreading, please have that evaluated. Mouth changes, including unusual sores, bleeding, or pain, should also be looked at. If you're worried, please make sure to speak with your doctor and consult with them. I do have this caution about checking Dr. Google. There are a lot of scary articles out there, and it can cause a lot of anxiety and worry if you type some of these things in, and our mind always typically goes to the scariest thing it could be. But I want to remind you that a lot of the times it's not cancer, and a lot of the times it's something else. But of course, we want to make sure that we seek care from our doctors and have that full evaluation. So when you do go see the doctor, if you are worried, what should you tell your doctor? What would they want to know? Well, first, be very clear about your symptoms, and make notes or take a diary if you need to, just so you can remember when you go there. It started on 2 weeks ago. It started 2 months ago. It started 2 years ago. That makes a big difference in what doctors are thinking about. Is it getting better or worse? Like I said, for the red flag symptoms, a lot of times it's the lingering symptoms that haven't gone away and are getting worse that we need to be more detailed in our evaluation and look deeper. Does anything help? What have you tried? Is it pain that helps if you take some Tylenol? Is the fatigue better if you lie down? All these things that make something better or worse, you should tell your doctor. Are there any other symptoms you're experiencing? Try to think about your whole body and see, maybe you think it's unrelated, but it could be related. And as I mentioned, family member history is quite important also when you're thinking about cancer, because there can be genetic factors that contribute to your risk of cancer. And have you had your regular cancer screening that is recommended for most or all individuals of a certain age group? And that's usually with your primary care doctor. And make sure your medications and supplement list is correct, because like we were talking about in the beginning, medications and supplements is really important to try to think about what could be causing your symptoms. And then one other factor that I didn't list fully on here, but I think is also important, is your lifestyle habits, and including in the past, if you smoked cigarettes, if you smoke cigarettes currently, alcohol, etc. Because those factors can sometimes change your risk for cancer and certain types of cancer as well. Here are some other tips that you might present as well to your doctor. Ask your doctor questions and make sure that you understand the next steps and any testing that needs to be done. With puzzling symptoms, the time is so important. The follow-up is so important. So make sure you're clear that you understand what's the next step and follow up. If you're not getting better and the test first comes back okay, but you still feel not well, make sure you make another appointment and tell your doctor that you are still not better. this part is so important because if you don't tell your doctor, they might assume you're better now. And we don't want to miss an opportunity to do the next step in diagnosis. And I would like to leave some resources because, you know, my caution about Dr. Google is that there are sometimes, you know, really scary articles out there or misinformation. And so you need to be able to find reliable sources of information. And it's okay to, you know, look on WebMD and Healthline and things like that. But if you're interested in learning some official, reliable information about cancer in particular, you can go to cancer.org, which is the American Cancer Society. And also, this is a great, reliable, trusted information through the medlineplus.gov. And this contains all kinds of health-related information, not just cancer, but also for general health and other symptoms that you're looking for. And with that, I want to say thank you so much, and I'm happy to answer any questions as well.
Thank you so much, Dr. Geng. I'll just talk about the Cancer Supportive Care Program really quickly. The Cancer Supportive Care Program is actually a program within Stanford Healthcare where we offer a lot of resources and workshops, educational workshops for cancer patients and caregivers at no cost. We don't go through insurance process. It's really a way for us to support the cancer patients as they go through their diagnosis, their treatment, and also into survivorship. And of course, you know, we're talking about hopefully you won't ever have to get to the point of having a cancer diagnosis. But if you or someone you know within your family or community is diagnosed and affected by cancer, we'll love to be a source of support for them. Okay, so one question that came in asked how to engage with your department.
Maybe what you are asking, and this is my assumption, but please feel free to follow up with another question, is how do we get to the diagnostic clinic that I run? Is that maybe your question? If that's the question, so our clinic is called Stanford Consultative Medicine, and we are a team-based diagnostic second opinion clinic for patients with puzzling conditions. So we focus on diagnosis, and the second opinion means that you have your primary care doctor, you have your regular care team, your regular doctors. And our clinic sees patients who are referred by your doctor who wants a second opinion about your case. And so the way to engage with our clinic is if your doctor, your own primary doctor, or whoever is the doctor who's following you, can then put in a referral. If they're at Stanford, they can do it internally. If they're external to Stanford, they can go through our website and the Stanford physician referral portal to put in a referral request to our clinic. I hope that answers your question. But I would definitely start with your regular doctor first, because we are not a primary care clinic. We serve as a second opinion to patients who have already been seen and evaluated by their doctor, regular doctor.
I actually have a follow-up question. Let's say if a patient is interested in being seen the second opinion clinic, how long is the current wait to be seen or to be scheduled to be seen by a physician?
Yeah, that's a great question. It does vary. And so it can be as quick as about, well, it depends on the relative kind of time frame you're talking about. It can be a few weeks, but it can also take longer. So right now we're quite busy, especially because of the holidays also. So like if you put in a referral now, it'd be most likely February or January, that kind of time frame. But it varies. Sometimes it's faster and sometimes it's a little longer, depending on the flux.
And would this visit be usually covered by insurance?
Yes, it typically is, as a consultation visit.
Great, thank you. And Maria did say that is exactly what she wanted, so thank you.
Oh, great, sure. And there is if you search the Stanford Healthcare website, I believe there's a link. I forget the exact /HTTP link, but I think it's something like stanfordhealthcare.org/consultative medicine might take you to our website that then has the external referral portal there too.
Great, thank you. Another question that came in, I asked, prostate cancer screening is recommended for men in their 40s and older. Is there a younger age group that should consider cancer screening or other general types of cancers?
That's a great question. And prostate cancer screening has had a lot of changes over the years in terms of its recommendations. Prostate cancer is one of the most common cancers. In the United States, it affects men and it's generally correlated with age as well. But the thought behind prostate cancer screening has changed because a lot of the times, and this is where each cancer is different. And when we think about cancer, we often think of it as, this fatal, like very life-threatening, dangerous thing, which some cancers are. But for prostate cancer, and this is an over generalization, there's different subtypes of prostate cancer, different aggressiveness that an individual may have. But for a lot of people who end up getting diagnosed with prostate cancer, they actually end up dying from something else. And so there is changes to recommendations for prostate cancer screening. And it might not be very high yield for screening a ton of younger people. And so I would say it's an individual decision that you need to discuss with your general practitioner or your primary care doctor. And like I mentioned, there are other factors that kind of go into consideration about your risks. And you also asked about other general types of cancers and cancer screening guidelines, for example, for breast cancer and for colon cancer in terms of the method, the timing, more data comes out sometimes, and those fine lines of cutoffs of ages of 40, 45, 50, they can change, and they have changed. And sometimes even depending on which healthcare organization you're looking to, for example, American Cancer Society or the United States Task Force for preventive care versus another society or academic medical society might have slightly different guidelines. And I want to reemphasize that, again, your personal history and your own risk factors and your own preferences, because sometimes there's no clear right answer. There are guidelines to help guide us, but we have to understand the cancer. What does this cancer mean for me? And what are my risks for this cancer? For example, in breast cancer, if you have a strong family history of multiple family members with breast cancer, and you may be in a category where you need for additional imaging, maybe even more advanced testing, depending on your family members' genetic history and your own risk factors. So I know that's not a one-shot clear answer, but I think it's really important for individualized care and discussion with your doctor.
Thank you so much. I also put in the chat of the consultative medicine department's clinic website, so that if anyone's interested to find out more, please feel free to refer to the link that has been sent out in the chat. We have one question that asks, how do you reevaluate information to give for second opinion?
Yes, that's a great question. And so we typically ask the medical records be obtained either internally, or if they're external, that be faxed to us. So it's multiple steps to the process. In our clinic, our model is team-based, detailed review, and a comprehensive intake, and a discussion, and using tools beyond what is typically used in primary care, to try to aid with differential diagnosis and deep literature search. What does that mean? That means you've had, a lot of people who come to our clinic have already seen multiple doctors before. And so it's important for us to understand not just the patient's story, and that's really important. So we sit down with them, have a full visit, have a history intake, ask questions, almost getting a brand new story, hearing it for the, firsthand perspective. And then it's important to understand, what did other doctors already test for? What are the labs and testing and imaging that has already been done? And there's no need to necessarily repeat some of those. Some lab tests are very standard. There could be specialized testing that might need additional repeat or further clarification. But for the most part, it's important to comb through the prior data and the prior evaluation. It's most important to also speak with the patient and evaluate, examine, and think about things. And then we take a team-based approach. So then we gather up all this data with the patient's permission, speak with our whole team of other consultative doctors and other specialists sometimes. And then we bring that thought brainstorming back to the patient. And some of those other tools we use in investigating are what's called artificial intelligence assisted diagnosis generators. So they're tools that have been kind of computer algorithms that help doctors think outside the box about rare diseases or unusual conditions. And then also our own group has developed a tool to be able to search through PubMed, one of the important medical literature databases, to look at case reports, meaning what did other doctors or institutions submit to our literature about patients who might have similar symptoms, and what did they end up having? So trying to explore resources as well. I hope that helps give an understanding of our process.
Thank you. That was actually a really detailed overview. So our next question is, are there any workshops on cancer preventatives?
That's a great question. And Esther, I don't know, as part of the Cancer Supportive Care Program, do you guys have any? This might be better for you.
So we unfortunately don't have any workshops on how to prevent cancer, but I think general rule of thumb is really lead a healthy lifestyle, good, adequate, restful sleep every day, exercise 30 minutes or more on a regular basis, and also a fair balanced diet that is filled with fruits and vegetables, less red meat intake, and also decrease amount of cigarette or e-cigarette or cigar smoking in general. I think those are really the rule of thumb. But if you have anything else that you'd like to add, please do.
Yes, that's great. And, in terms of, I think there's a lot of individual, things to consider too. There's so many different aspects of our lives, and I totally agree with leading a healthy lifestyle. But some aspects of cancer you can't control, right? And that's sort of the devastating aspect of it. Sometimes mutations happen, and that sort of, I definitely want to emphasize that, as cancer can be such a devastating diagnosis, and we don't want to blame ourselves for it necessarily. But what we can do is to try to lead a healthy lifestyle, including diet, lots of fruits and vegetables, which have a lot of great ingredients and nutrients that help, help our DNA repair and help prevent damage from certain chemicals, including antioxidants that help us. And then also for specific cancers, for example, one really easy preventable thing, if you're at risk for melanoma or certain types of other cancers, is getting sunscreen, sun protection, UV protection for certain types of skin cancers. And for those who have family history of melanoma or other skin cancers, or are prone to that, who have light skin types, you may want to get body screening and have a full skin check every once in a while. And so there are certain tailored things to talk about with your doctor that you might be able to do. I definitely agree about tobacco use, as well as and also alcohol, because there are certain cancers of the upper gastrointestinal tract, as well as increased risk for liver damage from chronic alcohol use as well. And of course, these are all lifestyle balances that you must decide in terms of your kind of lifestyle and desired quality of life versus, preventing cancer or certain types of cancer as well. But these you can discuss further and try to tailor individually with your doctor as well.
That's great. Thank you.
Sorry.
Oh, yeah, no, please
just
go for
add
it.
one more point, because I think a lot of our attendees are maybe Mandarin speakers or have maybe connections to the Chinese heritage or East Asian heritage. And if that's the case, I do want to bring up one additional point about lifestyle, and that's not necessarily just lifestyle, but also sometimes environmental or geographic exposures can lead to risk for cancer. So one cancer that is under-recognized in a way in Asian populations is, in the United States at least, is gastric cancer, so stomach cancer. And I wanted to bring that up because sometimes it's linked with things that can be treated. For example, in East Asia, there's a bacteria called H. pylori. And this is a bacteria that is very common. It's in a lot of our stomachs and digestive systems, especially in Asian countries. And this bacteria can cause symptoms like, for example, stomach pain and indigestion, reflux kind of symptoms, heartburn. And you definitely want to get that treated because that bacteria can lead to chronic inflammation and increased risks of stomach cancer. And there are also other lifestyle things that are probably diet related things, including, cured meats and certain dietary things that in some parts of East Asian diet. And so that might be something to consider as well if you have a family history of stomach cancer, or you just want to learn a little bit more about that, especially if you grew up in East Asia or have that kind of diet and lifestyle to consider.
And actually, on that related topic, is there an age that you recommend colonoscopy screening or endoscopy screening and what age would that start?
Yeah, so that's a great question. And there are standard guidelines for colonoscopy screening. So go ahead and, speak with your primary care about that. The endoscopy screening for upper, as of yet, there is not exactly clear guidelines. And so it's not like we recommend endoscopy screening for everybody. Reflux and gastritis symptoms, indigestion are very common, but that doesn't mean everybody needs to have an endoscopy, meaning a camera go down your throat into your stomach. However, what I mentioned about, especially of, East Asian heritage, or if you are from that area, you may have H. pylori, and that's something that can be easily checked with a stool test. And so bring that up if you have those symptoms with your doctor. Get that checked and it's treated with antibiotics. And but some of those warning signs that I mentioned about early satiety, meaning when you eat, you feel full, or you've had weight loss, or you have family history, or other, concerning symptoms on that list of symptoms I mentioned, definitely that might warrant an endoscopy. But, you should definitely discuss with your doctor about that.
Thank you. It's been such an informative session. I personally learned quite a bit, so thank you so much. And actually, this question is probably for me. Is the supportive care program open to the public? It is. It is the Stanford's Cancer Supportive Care Program is open to any cancer patients and caregivers, regardless of where they receive their care. So you might be a cancer patient that's receiving care outside of Stanford. You're more than welcome to participate in our program as well. It's definitely a community benefited program that we would love to serve any cancer patient possible. And actually all of our offerings are available online virtually. So it geographically is no longer a barrier, which we are quite thankful for. So on that note, I'm going to turn it over to Pinky so that she's able to close us off with some announcements from Avenidas. Thank you again, Dr. Linda Geng. It's been really a pleasure.
Thank you so much.
Thank you again for our partner Stanford Cancer Supportive Care Program, team members, and thank you, Dr. Linda Geng. Here's a quick overview of Avenidas Chinese Community Center, HCCC. Our actual location is located South Palo Alto, located in Kapolei Community Center. Our center is currently temporarily closed, but we offer our program Monday through Friday, focusing health and wellness, culture, and more online. Throughout the pandemic, we have actually expanded our online program to the 7th state and then outside of California, and then also 6 other countries worldwide. So thank you very much for your time today joining with us. Thank you, everyone. On behalf of Avenidas, ACCC, and Stanford Health, we wish you happy holidays. See you next time, everyone. Thank you.